I'm Dr. Kate Leisinga. I'm going to be half of your, well, maybe a quarter of your presenters tonight. We've got a big topic, a topic that we're all very, very passionate about, a topic that affects a lot of our patients throughout DBC, whether that's in health coaching, whether that's Dr. Denbor, myself, Dr. Stacy. So we're going to be trying to cram as much information in tonight's presentation as we possibly can. Stop us if you're getting lost, especially me. Please feel free to raise your hand and say, hey, can you repeat that? If there's a question that I'm not getting around to, or if something's confusing you, I would love to keep you all engaged tonight. So the understanding and treating depressive disorders is what we're going to talk about tonight. Now, we're kind of going to hit both depression and anxiety a little bit tonight, again, which is why we have so much to cover. So bear with us. We're going to be popping back and forth, talking about a couple different body systems that have to do with both of those topics, and hopefully educating you, hopefully giving you some good ideas, some steps to take for yourself tonight. So let's get started talking about the brain, because whenever we talk about depressive disorders, we have to start there. The brain, here we see a normal brain, okay? Brain is part of the central nervous system, right? The other part of the central nervous system would be the spinal cord. We have lots of different segments in the brain. Can anybody tell me what, can anybody tell me what this frontal lobe of the brain is for? There's a bunch of different lobes in the brain. The frontal one has a really important job. I think I heard it. What? You know it, you just don't want to say it. Frontal lobe is personality, okay? Personality, executive function we talk about, okay? Decision making, that kind of thing. When someone is under the influence of alcohol or drugs, this part of the brain is affected really quickly, okay? So poor decision making, poor reflexes, changes in personality. You'll see those kind of things with that stuff. We've also got some other lobes here. Down here we have the occipital lobe. Anybody know what that one's about? Occipital lobe of the brain? Yes, vision, very good. Ironic, right, that it's way back here. I always think that's strange. Tidbit, whenever you smack your head on something, if you whip your head back and then you see stars, that's because this part of the brain is sloshing and bumping back against your skull here. So that's kind of how I remember it. Seeing stars is in the back of your head, okay? There's a bunch of other different lobes. We've got our cerebellum here with balance. Here we have going down the spinal cord. Now, this part's really, really important, especially when we're talking about thought, especially when we're talking about mood, because we make some things here called neurotransmitters, okay? The brain has 100 billion neurons, and they're made up of, question mark? What's the brain made out of? What's neurons made out of? It's the main ingredient in neurons. It's white, okay? I don't know if that helps you at all. If you dissect a brain, it's white looking. Maybe a creamy color. Ooh, yeah, fat, very good. Our neurons are made up of fat and more fat, okay? Huge concentrations of that in our body. What does this mean for our diet? Need to make sure you're getting enough healthy fats, right, for your nerves to work. That's one thing that, unfortunately, right now in our society, we've poo-pooed fats, right? Fats are the bad guy. Not for the brain. The brain needs fats. So these neurons, their whole job is talking to each other, is communication, okay? And they do that across something called a synapse. And I'll show you a picture of that in a second. It's really fascinating. The messenger molecules that they use are called neurotransmitters. You may have heard that word before, neurotransmitter, right? Can you name a couple neurotransmitters? Anybody? Really common ones? Neurotransmitters.
Dopamine.
Very good. Dopamine is one. Serotonin is one. Very good. Any other neurotransmitters? Norepinephrine and epinephrine. Nice. Okay. We think that vitamin D might actually be a neurotransmitter. So there's a lot of different things that function about neurotransmitters. We're going to focus on a couple really important ones. But the main point that I'd like to make here is this all happens very quickly, 220 miles per hour. Okay, things have to really be humming in order for things to work in your neurologic system, including thinking, right? So a lot of times when folks have problems with neurotransmitters, if they're having problems with thought, if they're having problems with numbness, tingling, right, it's because those nerves aren't functioning well. They're not functioning fast enough. Can give you that kind of brain fog, right? Does anybody know what that feels like? Just where you just feel slow, right? That's because you're not moving at 220 miles per hour. Okay, so losing this connection or slowing that connection, that's what disease is. So one of the neurotransmitters we're going to talk about tonight is serotonin. Okay, here is a picture of an artist rendering of a synapse. Okay, so you have one nerve coming here. Okay, so this is one neuron, the end of it. And in the end of that neuron are little pockets of serotonin or any other neurotransmitter. Okay, there's a lot of different ones that the same process happens for, okay? We're just going to talk about serotonin because that's what we talk about with depression. On the other side is another nerve, okay? The beginning of a nerve, we'll think about it that way. And there's this thing called the synaptic cleft. It's a space in between those two, okay? They're not actually touching. So in order to communicate, what happens are these bubbles or these pockets burst and they release serotonin into that space, into the synaptic cleft. Then the serotonin floats around and it reaches this receptor, okay? There's a specific receptor for serotonin, there's a specific one for dopamine, norepinephrine, right? They all have their own receptors. If it binds here, that sends a signal to this nerve, okay? And the communication continues on to the next nerve, okay? So what happens here is really important, right? Making sure that number one, we have enough serotonin to release into the cleft. Number two, the serotonin is in a high enough concentration in the cleft. And number three, that it's binding correctly, or that there's a receptor there for it to bind. Okay? Nod if that sort of makes sense. Okay, good. Okay, I got a lot of you. That's perfect. Okay, so this is how nerves talk to each other, and nerves talking to each other, that equals feelings and thoughts. Okay, that's what we talk about. That's you know, when we're thinking about it scientifically, that's what we look at. We look at how well those nerves are working. Okay, just a little foreshadowing here. You can see inflammatory signals interfere with the fate of the neurotransmitter. And we're going to talk about some different things that can be inflammatory specific to neurotransmitter function, not having enough neurotransmitter, that kind of stuff for this not to function properly. Okay? So when we talk about the brain and we're talking about depression, which is going to be kind of what I do tonight, we're going to be talking about this system happening in the brain and in the periphery as well, more than you would think. Okay? Dr. Stacy, well, one thing that I wanted to mention was that for a lot of these things, this stuff going on here, we use pharmaceuticals and psychotropic drugs to help fix that problem. There's upsides and downsides to that, and that's what Dr. Stacy is going to mention right now.
So since I didn't get a chance earlier, I'm Dr. Stacy Fisher, Dr. Denbour, as everyone knows. But really, this actually segues very nicely into what Dr. Kate was talking about with the inflammatory signals interfering with neurotransmitter fate. Some of these signals could be interfered with from psychotropic drugs. One of the side effects of some antidepressants which have been used for anxiety is anxiety. So, are we using the right thing? We don't know. Some people yes, some people no. I pulled off some facts off the CDC website. Unfortunately, mind you, the website is a little off on its dating. The earliest, or the most recent dates that I could find was 2005 to 2010, so we're a little bit behind. But back in 2005 to 2010, approximately 6% of the adolescents aged 12 to 19 reported using a psychotropic drug in the past month. And that's just in 1 month. And as you see over here, it says number of psychotropic drugs, any, 1, 2, or more. So 6.3% of kids were using at least one type of psychotropic drug or any drug that they've used within the last month. Unfortunately, this I feel is low because I seem to run into a lot of children who are on more than one psychotropic drug. It's more common that antidepressants are used in females, and ADD or hyperactive disorders are used in gentlemen. And then also these are a list of the type of psychotropic drugs. So not only does antidepressants fall under here, there's going to be anti-obsessives for OCD. There's going to be your typical antipsychotics. And then, of course, there's some mood stabilizers. Your SSRIs, their tricyclics, and MAOIs are all antidepressants. So there's quite a bit. And I feel that there are some newer ones that have not made the list at this point. But that's quite a big list that we could be using with people. And a lot of times, many of these haven't been approved for the age ranges that we are using them for. So could that be an anti-inflammatory or an inflammatory event affecting a neurotransmitter? Possibly, absolutely. So as we're working our way through the body, Dr. Kate and I really wanted to focus in on the fact that this doesn't just happen in one segment. Just because we have depression or just because we have anxiety, maybe OCD, panic attacks, it doesn't mean it's only happening in the brain. Everything works together in your body, so it's not just one section. What I tried to tie in here for you is to show that the hypothalamus, which is Dr. Kate had on her brain picture set right in the middle of the brain, that works with the pituitary gland, which also then tells the adrenal glands what to do. Now there's also a hypothalamus, pituitary, thyroid axis that all work together as well. So these are very closely related. So say you have stress that hits one of these, it's not only going to affect your adrenals, which is what we look for a lot in the office, but it will over time affect the thyroid. These are two pretty big master organs that try to keep a homeostasis within the body. So along here are some of the adaptogens that Dr. Kate and I will be talking about tonight, things that can work to balance out the adrenals. And then over here are different things like zinc, vitamin C, I believe, magnesium, vitamin D, iodine. Those are all over here to help with the thyroid. So it's very important to keep a well-balanced diet as well. So we're going to talk a little bit about food this evening. Now everything doesn't come down to just one piece of the pie. So it's not about a lack of drug use for our serotonin deficiencies. I was looking through one of my books that I have at home, and one of the definitions that we have of depression is actually a clinical deficit of serotonin in the body or a neurotransmitter, and that could be used from either a drug overuse or a drug underuse. It doesn't necessarily mean that the body automatically started out with low serotonin. So I thought that was pretty interesting. So what is normal? Let's talk about first what happens normally in your body, and then we can talk about how it can go awry at this point. So traditionally, does everybody know who Hans Selye is? He's the guy that really talked about fight or flight, talked about stress. So he's the one that came up with a lot of these ideas. So fight or flight should happen when you're under acute stress. So think about you're out in the woods, you're walking, you're having a great time, checking things out, and oh my gosh, there's a bear. What are we gonna do? Run away, play dead? Where are we gonna go? This is what the body goes through in that acute stress, okay? My heart rate's definitely going up because I'm scared, right? My blood pressure has to go up at the same time. My breathing is going to increase. I mean, how many times have you had that quick stress and you just stay calm with your breathing? I can do this. Yeah, that doesn't happen. Pupils dilate in order to be able to see better, okay? We get muscle tension because we are preparing to run like crazy. I'm getting out of here. Your digestion should not be working at this time. The last thing that we want to do is urinate or defecate as we're running away, right? Not a good plan. And then of course, then we get some agitation, anxiety, and some of us get pretty shaky. Sometimes these are late stages, but this should happen very quickly. As soon as that bear is gone and out of sight and we feel like we're back into a safe zone, we should go back into the more relaxed state over here, which is called the parasympathetic state, okay? Heart rate will go back down, blood pressure goes back down, your respiratory rate returns to normal, your pupils start to constrict again. We start to be able to think, okay, I'm out of this, I can move on. Relaxation of the muscles, digestion starts to work again. So what we see a lot in this office is people coming in with digestive disorders. One of those things that we look for in digestive disorders is looking to the adrenals and the thyroid to find out, could that be a piece that is creating an imbalanced digestive tract? Because if we're in chronic stress mode and this stays high, it's very hard to help somebody regulate their digestive tract until you get this piece of the pie balanced. Does that make sense? Nod? No? Okay. Okay. Good deal. So this is what abnormality means, okay? So these are different conditions that patients can come in with when we have either an overactive response, so the stress response is always too high, or an inadequate response when the stress response is just really basically turned off. We've been stressed out for a long time, okay? So some of these we will be talking about tonight, like obsessive compulsive disorder. Hypertension and things like that we're not really touching on because that is not part of tonight's depression and anxiety. But you'll see seasonal depression is on an inadequate response. Atypical depression, post-traumatic stress syndrome. Anxiety should technically fall into this overactive response because they are basically kind of like a yin and yang of each other as depression and anxiety. So these are many, many things and only a very short list of what could happen with your adrenals being on all the time or not enough response when it's necessary.
Okay, so one of the big things that we talk about as well when we're talking about the brain, when we're talking about adrenals, is we go to the gut first. Surprising statistic that I found was that 95% of our serotonin in our body is made in the digestive system. It's actually not made in the brain, okay? 95% comes from the gut.
Quite a bit.
That's crazy, right? And that's because the gut has this incredible thing called the enteric nervous system. And it really does its own thing. It runs the show, okay? So when we talk about depressive disorders, we often have to think, okay, you know, I'm not getting that serotonin response that I want. Is it because my gut's not making enough, right? We don't often go there. We always think about the top brain. That's what I call it. The top brain and the bottom brain, okay? The top brain actually doesn't have that much to do with it. So when we're talking about the gut as the second brain, maybe the first brain, we have to think about gut health. Probiotics being a big part of that. Making sure that you're not toxic inside. I talk about the internal lining of your digestive tract is your inside skin, right? Making sure that that's healthy, it's not irritated, it's not inflamed. Using anti-inflammatory foods to make sure that you don't have damaged cells, right? If those cells in that nervous system are inflamed, they're probably not going to be making serotonin very well. Having adequate fiber in your diet, it's a big deal. Making sure you're well hydrated, it's super important for digestion. Healing the leaky gut syndrome, okay? How many of you have heard of leaky gut syndrome before? Haha, yes, okay. So it's starting to come out. We're starting to learn about what that looks like, what that means, right? So actually healing that tissue, that inside skin, making sure that you're not getting any toxins, anything past there that could mess up that whole serotonin production is a big deal. A lot of us eat too quickly, okay? It can be difficult, stressful for our digestion. It's part of being stuck in that fight or flight response, okay? I like to call the sympathetic nervous system fight or flight and the parasympathetic rest and digest, right? So you remember the two different ones there. So we wanna, if we're eating food, we wanna be in rest or digest, right? How many of you guys eat meals on the road? At your desk, right? A lot of us do. A lot of us are, let's get this over with so I can keep going on my checklist, right? Big deal. Making sure you have adequate digestive enzymes is important for gut health. Making sure that you exercise, making sure that you're managing your stress. Again, going back to that adrenaline. And then sometimes supplements also really, really help to do a number of different things here, but make sure that those cells are getting really good food. Make sure that everything's doing what it's supposed to do in the gut is super, super important. Again, we think about the gut making so many neurotransmitters for us. If we don't fix that and we just shove more neurotransmitters on top of it, that's not going to really solve the problem. And we need to solve the problem in order to get lasting relief. Okay? Makes sense? Kind of surprised? I was. Yeah, absolutely. Very shocking. So you can see here that mood, right, in the center has a lot of components to it. Inflammatory cytokines, okay, our inflammation, the chemicals in our body that are being released to cause that. Whether that's in my foot or in my shoulder or in my heart or in my intestines, that's going to affect my mood. We've got oxidative stress. Oxidative stress. A lot of people know the phrase antioxidant, right? Have you heard about that before? That's because it's anti-oxidative stress. Oxidative stress is where cells are damaged by something called free radicals. Okay? Antioxidants neutralize free radicals. So that oxidative stress, which a lot of times comes from our environment, but can also come from poor bacterial balance, that's a big push of mood problems. Stress hormones like cortisol, Dr. Stacy, I think, mentioned cortisol as being the sort of the buddy of adrenaline, right? It's our long-term stress hormone. And reducing that cortisol is a big deal for getting you into rest and digest. And then reduce neurotropic factors, which are nerve rebuilders, right? Nerve food. If you don't have enough of that, then you're definitely going to have mood issues. So we do see, oops.
Sorry, babe.
So it's okay. So we do see that those inflammatory messages do reduce serotonin, which is a catch-22 because then reduced serotonin increases inflammation. So we go to the gut, right? We go there because that's the source of fixing serotonin. There's a lot of other things we can do too, but that's one of the big things that we do. Go ahead, Dr. Stacy. Thank you. So what does depression look like? I am surprised every time that I meet a patient at how much range there is to symptoms and where people are. There's a very broad spectrum of what this looks like. Can somebody name a symptom of depression that maybe pops to your head right away? What's a symptom of a depressive disorder?
Chronically sad.
Yes. Mm-hmm. Yep.
Sleeping all the time.
Sleep, yeah, sleep disturbances, very much. Serotonin has a lot to do with regulating sleep, as well as appetite, which is interesting, memory and learning. So it has a lot of things to do with that, right? You're going to see deficits in all those areas. A lot of people have either chronically reduced appetites or enlarged appetites, right, when they're depressed. What else?
Loss of interest.
Loss of interest, absolutely, where they just don't feel much at all, or they don't feel like doing anything anymore. Has anybody ever met a depressed person with pain, right, as part of their depression? That's a big deal. A lot of people will have chronic pain associated with depression and serotonin issues and these same things. So again, it looks different. Now, it was interesting when I did a Google search for images of depression, I thought that my computer had switched to black and white mode, because every single image in Google Images was in grayscale, black and white. And a lot of people, I think, feel that way, that the color is turned off in life. I've got some images coming up, not yet, that will describe to you a little bit better too, some artists' rendering of what it feels like to have depression. But a lot of things that people will do is self-medicate, okay, for these sort of things. Can anybody tell me one way that somebody who's depressed might self-medicate?
Drinking.
I heard it. Alcohol's a big one, right? Alcohol's a big one. What else? Alcohol, drug use. Yep. Yep.
Smoking.
Smoking. Yes, absolutely.
Food.
Food. Food's a big one, right? It's like the hidden one, right? We can see some of the other ones quite clearly, but food is just as addictive and just as much a coping mechanism. So a lot of different things that we do to self-medicate. Unfortunately, that road doesn't usually end well. We lost a comedian this year to depression, and he was a very happy person, right? If you had seen him, I think people would have been surprised to know how deep that depression was for him. And this is the person is scary for me as a clinician, the person that really hides it, and you don't know, and then all of a sudden, they do something really terrible because they're so sick. So when we're looking around us, right, when we're looking for people, don't forget the person who does this all the time, right? When we're looking at depressed folks, you can switch. Another artist rendition that I thought was very accurate was the feeling of nothing, right? Your birthday feels the same as everything is spiders. You know what I mean? I mean, there's just a dullness, a lack of feeling. You can go next. A lot of depressed people will try to force themselves to be happy. Or a lot of people who don't understand depression will say, well, I don't get it. Why don't you just cheer up? I mean, life's not so bad. This is how they feel, that there's nothing that they can do about it. Next. A lot of other people feel like they have to hide it, kind of like the whole Robin Williams thing, right? They get up every morning and they put on their happy suit and they walk around with a bunch of other people putting on their happy suit, but inside they're very, very sad, they're very depressed. So what are those things that we look for, that we look at when we think about depression? Next.
Sorry. All right. Kind of switch gears a little on you. So as we go back and forth with these, anxiety has a lot of the opposite looks that depression will have. So what are some symptoms of anxiety?
Restlessness.
True. Very much so.
Sleeplessness.
Yes. Insomnia goes a lot with that. Anything else?
Uncontrollable thoughts.
Very true. Can't control anything, so everything's going to attack me. Absolutely. Yep. Chronically in fight or flight. Absolutely. So this is a lot of times a chronic worrier as well. What can I do next? What can I do? What can I do? Can I control it? Can I do this? So it's no matter what happens. And just as Dr. Kate had said, you know, there's a lot of different faces of depression and anxiety. And what I like to point out is the one on the far left, or your guys' far right. She looks pretty normal. Doesn't seem like she would have anxiety. But we all tend to have our own masks that we wear very well. So anxiety has a lot of symptoms. There's not just one, there's quite a few. So your anxiety disorders get to be put under a lot of things. Many people think of panic attacks and they think of anxiety. Obsessive compulsive disorder, it's not one that commonly people would put under anxiety, but these really are truly a definite anxiety person. So when things get to be high, then we got to have a constant order. I've got to put this here. I've got to have this step. I've got to do this in order to try to control things, because you feel like when the anxiety is on top of you, I can't control anything, so I want to control one minor thing. So post-traumatic stress can also fall into anxiety disorders. There's a lot of people that will go under stress and afterwards they'll either hit depression or anxiety. It just depends on where their body was sitting before the stress event happened, okay? This can happen after a car accident. It can happen after an injury. It doesn't have to just be after some major traumatic event where you think you saw somebody die. That doesn't end up having to be just that issue. Social phobia. A lot of people with anxiety have trouble hanging out in crowds. This is a big one for them because for them it's just, there's too much out of control that they can't hold on to. So they like to be alone for a lot of times. So you'll see this person turn down going out a lot. There's also mixed anxiety and depression that tends to go together. So you're kind of stuck right in the middle. Go ahead. So I picked out a few cartoons that I thought were pretty fun. Anxiety girl, able to jump to the worst conclusion in a single bound. This is definitely what a lot of patients with anxiety will come in and say. Oh yeah, there's got to be the worst thing. These are what a lot of clinicians like to call a hypochondriac. I've got that. I definitely have that. I heard about it on the TV. I definitely have it. Oh my gosh, I'm going to that one next. I'm going to die in 5 days. It's okay. I'll be fine in 5 days. You know, that kind of thing. And of course, Charlie Brown. I absolutely love Charlie Brown. You always have to think about him. My anxieties have anxieties. That's so true. And here's the funny thing, people that have never experienced anxiety, it's much easier to kind of cast a shadow on and say, oh, I just don't understand why life's too short to be sad. It's just have confidence, take the plunge. It's all in your head. Why can't you just cheer up, get some guts? And the person in the middle is going, yeah, it's so much easier for you to say. I'm in the midst of it. You know, I can't even see out of the hole that I'm in right now. So very important to remember that being in somebody else's shoes is different. All right, and I am going to turn this over to our lovely health coach, Dawn, and she is going to be doing a little bit of discussion on some lifestyle changes you can make.
All right, so I want to talk a little bit about foods for mood, some different foods that we can eat that will help with some of that mood regulation. Folate is something that can be a mood regulator. So where might we find foods that have folate in them? So there you're looking at foods like legumes, leafy greens, nuts and seeds, fruits, help to regulate mood. Selenium is a mood booster. Anyone know a great source of selenium?
Chocolate.
I'm thinking of another one. Brazil nuts. Who likes Brazil nuts? Yeah? So 6 Brazil nuts have 100% of your daily dose of selenium. How easy is that, right? Keep a little bag in your desk, in your car, in your purse, in your bag. There you go. Zinc is also a known mood balancer. Almonds, a great go-to there to find zinc. GABA, that can be like a natural Xanax, right? The chill pill, yeah? Where can we find GABA? GABA we can find in foods like kimchi, also oolong tea. Yeah, so just include those in your diet. Tryptophan, tryptophan is the precursor for serotonin that we've been talking about. So where are some places that we can find tryptophan, which would be like your natural Paxil?
Turkey.
Turkey, for sure, turkey. Other sources, pumpkin seeds, edamame, avocado. Natural Valium we can get from magnesium and B6. All right, leafy greens are huge here. Mountains of them. Eat them, eat them. Leafy greens. Nuts and seeds are also a great source of magnesium and B6, as is nori. So a lot of us might be a little afraid of eating seaweed, right? It's a great thing to just kind of crinkle up and sprinkle on a salad. Gives a lot of great extra flavor. Nice way to get in that magnesium and B6. L-theanine is an amino acid compound. It's found in green tea, and it has been shown to have a calming effect. So go ahead and drink up on that green tea. Serotonin we can find in that dark chocolate, right? So my encouragement for that dark chocolate is up to an ounce a day. And I'm gonna encourage you to try that 85%, right? Not just the 70%, go to that darker, that 85%. Less sugars in that really can be a healthy part of your diet. All right, it's not just one thing though. Wouldn't it be great if we could just eat Brazil nuts and everything would be hunky-dory, right? Don't you sometimes feel that way? Like if you could just tell me the one thing I have to do to feel better, I would do it. Well, it's more complex than that. All of the foods that we eat are complex. Everything we do with our lifestyle affects all of those hundreds of thousands of chemical reactions that happen in our body, particularly with food. So I want to, before I go to this slide, I just want to kind of review a little bit of a recipe to kind of give you an idea of how all of those nutrients need to come together and combine to work well. So this recipe is actually on the chair back there, and you can take it home with you if you like. It's for an artichoke edamame asparagus salad. Now, for those of you who may be sensitive to soy, go ahead and swap out any legume in there. Kidney beans work great, black beans work great, but I just kind of want to go through some of those ingredients. Garlic. Just read an article today of all of the amazing things that garlic can do. Huge immune booster, great for health. Olive oil, healthy fat, great for brain and nerves. Lime juice, immune booster. Dried oregano, calcium, magnesium, iron. Artichoke hearts, 19% of your daily requirement of magnesium in a serving of artichoke hearts. Also has vitamin C, iron, B6, calcium, and mountains of antioxidants for that oxidative stress that Dr. Kate was talking about. The edamame, huge protein, fiber, vitamin C, iron, magnesium, calcium, and also B6. And then the asparagus in the salad gives you a multitude of antioxidants, vitamin C, folate, B1, selenium, magnesium, calcium, potassium, and on and on and on. So do you see how we need all of those things to come together to help our body work in synergy? So that goes with our food, those micronutrients, but also with our macronutrients. So food, overall, we just want to be thinking about nutrient value. The salad that I just talked about compared to a Pop-Tart, which one has greater nutrients, do you think? For sure, the salad, right? That's where we want to be eating those kinds of foods. Colors for the antioxidant. Eat the rainbow, okay? Lots and lots of color in your diet. Complex carbohydrates, so your legumes, your fruits, your vegetables. Healthy fats. Name some healthy fats.
Avocado.
Avocado. Coconut oil. Nuts. Olive oil. Dr. Denbourn, my latest new find, avocado oil. High smoke point, 520 degrees, has this great buttery feel to it, excellent flavor. Include that in your cooking. Proteins. Healthy proteins are important as well. So looking at things like legumes, nuts and seeds, fatty fishes, eggs, make sure your fish is wild caught, chicken, grass-fed beef. And then when we are eating these macronutrients, we really want to focus on blood sugar. So balancing those together, that's probably a topic for another whole seminar, or you can always come and visit me in the office and I'd be happy to kind of teach you more about blood sugar. But blood sugar is hugely important for mood regulation and mental health and well-being. I know the doctors are going to talk a little bit more about some of the other lifestyle things like movement and sleep and relaxation. Those are all part of creating that healthy environment in our body for better mood.
One other thing I wanted to say about blood sugar regulation and the brain. We are learning, and we gave a seminar about this, but we're learning that Alzheimer's is actually now being considered type 3 diabetes, where your blood sugar in your brain is not regulated. And that's what's causing a lot of the problems having to do with those tangles and problems in the brain with Alzheimer's. So, you know, another really good connection between the brain and the gut, right? How you regulate your blood sugar. So, super interesting point. Thanks for making that, Dawn. What else can we do? Fix the gut, right? We talked about that. Not going to beat that dead horse. We know that. Not always fun to do, but really, really important. Exercise, super, super important for brain health, okay? You've heard of something called endorphins, right? As mood boosters, right? A type of neurotransmitter reaction that's happening in your body that can be a result of good exercise. Vitamin D. Anybody heard of seasonal affective depression? Yeah, right? This is when we don't get enough sunshine, when we don't get the right cycle of sunshine. Has a lot to do with vitamin D deficiency. Every cell in your body has a receptor for vitamin D. It is one of the most ubiquitously needed substances in our body, and so that's another reason why it's really, really important. It can really help stave off and maintain that vitamin D level so you don't have it in the wintertime. And then talk therapy. A lot of times this is one of those things that we don't talk about here at the office, and I think we need to talk about more, is seeing a therapist if you are experiencing depression or anxiety, because there's a lot of really, really cool things that happen in your brain and happen in your adrenals when you talk with someone about these things, when you are able to work towards a solution, okay, as opposed to it's fighting that, right, that instinct to be a recluse that occurs when you have a depression or anxiety disorder. So talk therapy is very, very important as well. I can't stress that enough. I know lots of people who benefit hugely from this as well, and if you're a patient here and you're looking for somebody who would be a good talk therapist for you, please ask us doctors. We've got a lot of people that we work with that are really awesome. So supplements, okay? We talked about a lot of foods, a lot of ways to get some of these things in your diet. Sometimes it is just not enough at the beginning, okay? A lot of people find that they need that extra boost in order to get things that they need into their brain to make serotonin, to make enough GABA, to calm down their adrenals, right? So I'm gonna go through my favorite 3 right now. This is more towards depressive disorders, and Dr. Stacy's gonna talk a little bit more about the anxiety disorders in a second. So number 1 is called Serotonin. Serotonin is a very balanced mood stabilizer for a couple reasons. It has 3 major components to it. Ginseng. Ginseng is very important in regulating adrenals, okay? Helps calm that whole adrenal fight or flight. Also, if you have gotten to the point where you're completely burned out adrenally, ginseng can help boost that. It's an adaptogen. It does both. L-theanine, okay? L-theanine is a precursor to GABA. GABA is calm down, right? It's an inhibitory neurotransmitter. And it's for that overwhelmed emotion feeling, okay? It does, it's like that chill pill. And then it also has something called 5-HTP. 5-HTP is a precursor to tryptophan, which is a precursor to serotonin. Yep. So you see we're hitting all kind of those 3 different things here with the Sericin, which is one of the reasons I really like it. It's a very balanced approach. Blissfora hits a little bit of a different system in that it gives you a lot of your B vitamins, B12 and folate, okay? B12 and folate are really important. Now, some of you guys have heard about this before, but for some of us, it's really hard to use the B vitamins in our diet. And that's because we are poor methylators, okay? Methylation is something that we have to do in order to add a group onto B vitamin in order for it to be used in our chemical pathways in our body. Okay, that's the simplest way I can describe it, believe it or not. So these B vitamins are kind of pre-methylated for you. Okay, they're made much more available for your body in case you have a deficiency in that methylation process. And that's usually a genetic thing where you have a little bit of your genetic code that is flipped or it's snipped off, in which case you struggle to methylate those B vitamins. So that's already done for you. And then SAMe is, again, another part of that whole process, making neurotransmitters. It's a precursor to a bunch of different ones. Dopamine, serotonin are both included in that. Okay, so we really like Blissfora, especially if we have a person who we suspect is a poor methylator. Okay.
And that's a lifesaver for a lot of people.
Yeah, it's a really nice one. Serenogen is last. Serenogen is really, really old school medicine, okay? It's our Chinese medicine formulation, okay? It's got a lot, it's got a lot of research behind it, but it's also kind of that tried and true, right, as far as being around for dynasties, literally. This is for the person feeling just emotionally overwhelmed. So it kind of hits both the anxiety and the depression. Somebody who tends to be really close to tears a lot. Somebody who feels like they're burning the candle on both ends. There's a lot of different ways that we decide which ones to use in each person, and sometimes there's a little trial and error that will occur, but any of these would be wonderful for somebody with a depressive disorder. That's kind of the beauty of using supplements as opposed to pharmaceuticals, is that there's really no harm to be done. Now I will mention another reason that we really like Blissfora is that it can be used with SSRIs. So if someone is taking a medication already for depression, we can use Blissfora to either help them wean off of that or on top of something like that. So that's another reason that we really like it.
You have one more?
Oh, I have one more. Oh yeah, I wanted to show you this. I just found this one, so I wanted to show you. In the research field even, we're seeing some pretty substantial evidence for folate and B12s in treatment of depression. Pretty much anybody who has a psychiatric disorder is going to be low in B vitamins, but we didn't know that it was actually quite causal. So what they're seeing is this MTHFR, that's that methylation problem that we have, that is overrepresented among depressed patients. Basically means if you're depressed, your chances of having this genetic SNP or polymorphism is extremely, extremely high. Another research article that I saw actually said the words cause. So that this genetic polymorphism or B vitamin deficiency causes depression. And that is bold right there for them to be able to put that in research. That's a really strong correlation. So that's why we have something like Blissfora. That's why we really need to make sure that we're getting those methylated Bs going.
So is there a test?
You bet. Yep, you can test that genetically to see, for sure.
Can I just get clarification when you just agreed upon back there? That can be tested?
This genetic polymorphism, you can test for that. I mean, you can get all of your genetic information these days. It's just interpreting it that's the trick, right? Because we're still not entirely sure what's normal and what's not normal. But we know that this SNP is what it's called, this damaged area in the genetic code means that you don't do this really crucial process very well. And you can have, not to get too in depth, but you have 2 of these genes, right? And you can have one of them maybe be faulty and one of them be okay, or you can have two of them be faulty, meaning that you don't do this barely at all.
So you see this being pretty genetic?
The MTHFR is a genetic thing. Yeah, for sure. Do I think depression is genetic entirely? No, I wouldn't say that. But I would say that there is a definite correlation between this, the inability to get your B vitamins, and depression kind of all together. Again, I still think most of it goes back to the gut because that's where you make most of your serotonin. But at the same time, this is a little bit upstream of that yet, so I think that that could have a big impact on that too. Yeah?
Does this relate to the gut's ability?
You bet, right? Because you're, well, part of it. If you're not absorbing food well, if your gut is toxic, it's not going to be able to make serotonin anyway, I guess is what I mean. If you have a perfectly healthy gut and you still have this, then that's going to be an additional issue. So I would say if your gut is messed up, it doesn't matter if this is there or not, because you're not going to be, those cells aren't going to be able to make enough serotonin anyway. If you fix the gut and you still have issues, then you might check and see, or you might treat both at the same time, right? Just to kind of hedge your bets. Nothing wrong with B vitamins. Yeah? Let's move on to anxiety, and then we can always catch some more questions at the end.
Okay, so on top of, I'm going to hit a few things that I know I didn't put into the slide, and I thought they were very important as I'm thinking about as Dr. Kate's talking and as Dawn is talking. There obviously are some things that we can do to help to avoidance, to help with the brain function better. One of them, which I know we've exhausted at a lot of seminars, is gluten. Taking gluten out of the diet a lot of times will be calming those nerves down. They take that excitability out of that. A lot of us have sensitivities. It doesn't mean we're allergic, we're just sensitive, so it can heighten these responses. We've had multiple times where we've taken patients off gluten, put them back on as they reintroduced, or they accidentally got some and call it with suicidal thoughts. You know, so it can be that to that extent for many patients. And some people it can just be minor, where they just slip into, today I just didn't feel really great, and I don't really want to do anything, and kind of that mopey thought. So there's many things in the piece of your pie that you're trying to deal with when you're looking at anxiety and depression. Anxiety and depression both need to have a full balanced lifestyle. So that's why you're going to see that we not only talked about food, we talk about how the body works together, how the gut is very, very important, not only for serotonin, but also for all of your neurotransmitters. If your gut is not balanced and happy, it's very hard to keep your brain balanced and happy, because this is not digesting and breaking down all those nutrients your brain absolutely needs to function. So say you're having high blood sugar, low blood sugar, high blood sugar, low blood sugar. The brain is going to go through that exact same phase with your digestive tract, which is going to set us on highs and lows, highs and lows, highs and lows, highs and lows. So if you find yourself in the middle of the day, 3 o'clock, I need that sugar, oh my gosh, I got to find myself that piece of chocolate, possible blood sugar, possible imbalance of other things going on in the body. Maybe magnesium could be there as well. So one of the things I love to talk to patients about is, where are your islands of peace? Think about yourself as your checking account, okay? Where do we all like our checking account to be? Positive numbers, right? We never want to overdraw, right? What do we do to ourselves every day? Exactly. We overdraw the account every day. Why? Because we're chronically pushing for that next thing. We've always got something more on the plate. I need to do this. I need to do that. A big word to use is no. I don't have time. I have to work for myself. Because remember, if you're not around, think about all the other people that are around that you work with or you try to help out. If you're not healthy, you're not going to be able to help them. So that's very important as family members to think about that. So I like to talk about progressive relaxation. Think about this as, you're sitting at your desk, takes 10 minutes to yourself, and think about, okay, when I think about relaxing my fingers, okay, I feel relaxed. I think about my wrists. They're loose. Move on to my forearms. Okay? Starting to become jelly here in my chair. Right? Move on to your shoulders. Move all the way down till you get to your feet. Hopefully by then you're not asleep, because that kind of defeats the process. And you might be missing your lunch hour. But this is a very, very time-honored tradition to help the body relax, because what can you focus on? Only that piece of the body. If your mind wanders off, we need to bring our focus back. This is where we're struggling. Belly breathing. This is also called deep breathing. Dawn teaches this to a lot of patients in her room. I always hear her talking about belly breathing. So everybody put their hand on their belly, one on their chest. Okay? Take a deep breath in. Which hand raised first? Okay, good. If your hand on your chest raised first, you need to think about breathing deeper through the belly. The hand on the chest should raise last, okay? So what is your second rule? In how many?
4-7-8 breathing is a really great one for relaxation. Inhale for a count of 4. Hold for a count of 7. Exhale for a count of 8.
So inhale 4, hold 7, exhale 8. Believe me, you should be relaxed after that. If not, you might be hyperventilating. Just kidding. I love the other ones. Rub feet over a golf ball if you're not comfortable with golf ball, tennis balls, like your own little mini massage. This has wonders. There is a bunch of different acupressure points on your feet to help to relieve different areas of the body, digestion, kidneys, liver. Just rubbing that around helps to get those things moving. So those are great to do. For those of you that love to write, writing in a journal. A lot of times this is a way to just dump the stress of your day. Write it down. Some people will read their Bible. Great, do that. Get rid of some of that stress. Let it all go to someone else. Get organized. This is great. Has anybody ever cleaned a room in their house and felt like entire world has been lifted off their shoulders? And it's because we're getting organized. We tend to hold a lot of clutter, right? Uh-oh, I got shakers in the back. Uh-oh. So maybe not for you two. We'll kind of work on you next. Read. Reading is wonderful. Doesn't matter what kind of book, just read. It's always a great thing. Something else for those of you that are in the car a lot, a book on CD. Sometimes really helps the time go by, and you don't get as stressed out about the traffic. If you get stuck into a traffic jam, oh look at that, I get to listen more to my book. I'm a big driver, so I go through books on CD like crazy. Laughing. There are so many endorphin releases with laughing. Anybody heard of Patch Adams? So his main premise was he believed that if he could help people laugh and smile, that he would also allow them to heal. And it is very true. Those people that are more positive, that laugh more, that enjoy life, make the most out of it, have less sicknesses. And it's because of a positive outlook. Talking with a friend. Now this tends to be more of a female thing. Doesn't always fall in with you males. It's okay. But this is an oxytocin release for us. It helps to relieve stress. So this is one thing, if it's something that you need to add into your island of peace for that day, go ahead, talk to somebody. Sometimes you just need to get that off your chest. Now these are something that you don't get to do just weekly. This should be daily, a couple times a day. Find a few things that work for you. Even if it's only 10 minutes, you're adding into your bank account. So you're allowing your body to go through short seconds of healing. Just like Dr. Kate had talked about, don't eat while you're doing something else. You shouldn't be eating at your desk. We shouldn't be eating while driving. Because what are those doing? That's not allowing us to heal. That food, even though it could be the best salad in the world, and you could be eating at your desk all stressed trying to work at the same time, that salad went from healthy to, oh my gosh, I'm stressed out. So you may have put good nutrients in, but the body cannot use it because we've overstressed it. Thank you. So different supplements that are, now this is not my exhaustive list. Dr. Denver, Dr. Kate and I talked about, we could basically pull something out of Nature's Remedies from every shelf and say, okay, we could definitely use this, we could definitely use this. So I picked the ones that I tend to start with when I deal with anxiety, and some of these go with different depending on the type of patients. Now as you see, I did put a homeopathic up here for aconite. There are so many children that we run into in this office that struggle with stress. I have a lot that are worriers, you know, Mom, are you going to be okay when I'm gone today? They don't fall asleep well, they don't stay asleep. Aconite does a really good job to help balance those little kiddos back out. Homeopathy is such a wonderful thing. NeuroCalm has a lot of the B6, magnesium, taurine, N-acetylcysteine, and EGCG, which is the active component from green tea. So all of these obviously are working toward building up GABA within the brain. Now remember that GABA and serotonin are more of your relaxing neurotransmitters. So these two kind of work hand in hand. So you'll see there's a lot of overlap between some of the supplements. Now Serenity and Serotonin, which Dr. Kate had talked about, very similar in thought process and how they're formulated, different formulas. This one has L-theanine, GABA, inositol, taurine, 5-HTP, which hers had 5-HTP in there as well in one of hers. The 5-methyl tetrahydrofolate, that's your active folic acid in a methylated form. B6, C, zinc, and magnesium. That's a pretty big formula when you think about it. Everything that works in through there. So you're working on serotonin, you're working on GABA, you're working on blood sugar, you're working on methylating your B vitamins, you're adding extra B6 because your adrenals will need that. You need the vitamin C to support the immune system, the zinc to support the immune system, and magnesium to create the relaxation. Did you catch all that? Okay, good deal. The other nice thing about zinc and selenium that as I think about that, that's important for your immune system. So when we're stressed, do you notice that you tend to get sick more often? Another piece of that pie, trying to keep yourself healthy. Most of us end up getting sick after a stressful event. Tran-Q is one of those adaptogenic herbs, very similar to Serenogen. I love this one. This one I use a lot in ladies that get married. You know how stressed they are on wedding day, right? This one is wonderful. It's like you gave them a Prozac all day long. Oh. Everything's great. Wonderful. Yes. So this one works within 30 minutes of using. If I need somebody to get a little bit faster response, I'll have them chew it. It's not as awesome tasting, but it does work very well. This is one that I would consider more of one of my Band-Aid products for an immediate cortisol drop and helping the body deal with the stress. So it's not going to be something that I would use long-term to help somebody deal with anxiety, but it's a good one to help get things under control so that we can focus on the most important things when it comes down to it. Nucera, this is a casein tryptic hydroxylate. Yes, you see it, casein, dairy. A lot of people look at that and go, oh my gosh, that's a milk extract. Many patients who have milk sensitivities can still tolerate Nucera because of the way this is put together. This is basically a chocolate chewable. And for those of us who absolutely love chocolate and have little moments of stress or trouble sleeping, Nucera is the place to start. This one is meant to be chewed. It's meant to be chewed for up to 60 seconds in the mouth. That way it allows to release into the salivary glands and then can go to the brain effectively. This one is great for those tense moments as well. So if Tran-Q doesn't work, a lot of times they'll go to Nucera. They work on different areas within the brain and the body. So this one, if I have somebody who just struggles to fall asleep and it's only, I take 15 to 30 minutes to fall asleep, a lot of times we'll start with Nucera. This is a good place to start and see, is it just because we have minor stress? Because this one's meant for more minor times of stress. Not those that are chronically stressed, but I had a rough day. It's not a usual one for me. I just can't slow down. Great place to start. Okay?
I use it in people who are afraid of flying.
That's a great one too.
So they'll take it before they get on a plane or something. Or if they have a big presentation at work.
Yep, great one. Absolutely.
Next.
All right, Dr. Denbour. We're going to bring out the big guy to wrap us up. I hope you guys don't mind.
Wow. As I was sitting there soaking it up, I'm looking at each of these slides. Each of these slides is worth a seminar on its own. Truly. And this was a tour de force of some research as it's happening in the whole psychiatry field. This is drawn from the medical journals, folks. This is not alternative. This is taking it to the next level. This might not be traditional, but it will be. Because this is not alternative medicine, this is just better medicine. And I was trying to think on how do you sum something like this up. And I'll try to do it this way. Medicine, how does it work? It works by poisoning a system that is too robust. That's how it works. That's why the word anti is so common in medicine. Antidepressant, anti-hypertensive, antibiotic, right? It poisons a too robust system. Let's look at it a little different. We're so complex. There's all these systems that interplay within our bodies. and the brain interplays with all of them. So why not balance the system instead of poisoning the system? And that's what we're doing here. We're working on balance. So if something is out of balance, let's figure out what is out of balance and rebalance that. New patient today comes in with multiple symptoms of PTSD from Vietnam War, post-traumatic stress disorder. And he was thrilled because through talk therapy, he finally recognized it, which is half the game, right? Recognizing something. But now, he was blaming all of his ailments on PTSD, and I said, no, 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 no. Because how many of your fellow compatriots have exactly your symptoms? He couldn't think of one. I said, well, then why do you have PTSD and the others didn't? Something else is off balance that allows you to display the symptoms, and the events that happened in Vietnam was only the final trigger. Not the beginning of the event, but the final trigger. And often we base our diagnosis on just that. Diagnosis, PTSD. No. That should be the beginning of the journey to figure out what is going on. And a lot of that ammunition was given tonight. Good luck with your journey.